Welcome to Ask an MS Expert. I'm John Strum, your moderator and host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years. So I've had a front row seat experiencing all the ways that MS can impact a family. Today, I'll be asking our expert the questions you want answered. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators will be online throughout today's live program, answering your questions and connecting you to resources. Open enrollment is the one opportunity you get each year to make changes to your health insurance coverage. So it's especially important to understand your options and enroll in the health insurance plan that offers the best coverage for your needs at the lowest possible cost. Joining me to help us decipher those changes and navigate through the sometimes confusing world of health insurance is Sarah Anderson. Sarah is a pharmacist. Welcome, Sarah. Thanks for being with us today.
Thanks for having me, John. I appreciate it.
I find the best place to start these conversations is right at the beginning. So, with that in mind, Sarah, what are the main sources of health insurance?
Yeah, the main sources of health insurance here in the United States are employer sponsored plans, government programs such as Medicare and Medicaid, and we'll be diving a bit more into Medicare specifically here today. And then lastly, individual and family business plans.
What kinds of things should people consider when they're choosing a health plan? And are there any specific considerations that people living with MS should be aware of?
Yeah, these are great questions, John. So, when choosing a health plan, people should consider factors like their current and anticipated health needs, the plan's network of providers, monthly premiums, deductibles, copays, out of pocket maximums, prescription drug coverage, whether their preferred doctors are considered in network. Essentially, people want to balance the cost with the level of coverage that best suits their individual healthcare needs.
I've heard that when you're choosing a health plan, it's important to consider which providers are in network and which medications are actually covered. How would someone know that information?
Yes, those 2 points are very important when choosing a new health plan or switching health plans. People can search for their providers on the health plan website for those health plans that they're researching to determine whether their healthcare teams are considered in network. People can also call the insurance plan providers to find out whether the plans they're considering covers their specific medications. It's also important to be sure to ask about copays and coinsurance for filling and refilling prescriptions. And for comparing Medicare plans specifically, you can go to Medicare.gov as they have a health plan finder tool that allows you to compare plans as well as compare prescription Part D drug plans.
A moment ago, I mentioned that open enrollment is a special one time only time of year for making changes to your health insurance coverage. What exactly is open enrollment and why is it so important?
Yeah, great question. And during open enrollment, Medicare beneficiaries can switch between Medicare Advantage plans, switch from original Medicare to a Medicare Advantage plan, or vice versa, choose or change Medicare Part D prescription drug plans, as well as add or drop drug coverage. Some reasons to consider changing your plan during open enrollment includes if you have had a significant change in health status recently, if you've had a significant increase in your premiums, if you've had an increase in out of pocket costs for medications that you currently take, if you're moving to a new state or zip code, if your plan has been canceled, or if your healthcare team is no longer included in your plan's network.
Can you tell us how someone knows whether they're eligible for Medicare and then how do they go about signing up?
Yeah, great question. So, eligibility for Medicare depends on a number of factors, including age, citizenship status, and whether you receive Social Security benefits. So, most people are eligible for Medicare 3 months before turning the age of 65, as well as up to 3 months after. You must be a U.S. citizen or permanent resident. If you receive or are eligible for Social Security benefits, you may be automatically enrolled in Medicare Part A at age 65. You also may be eligible for Medicare earlier if you have a disability. If you or your spouse worked long enough in a government job or paid Medicare taxes, you may be eligible for Medicare Part A. And if you have been married for at least 1 year to someone who is at least 62 years of age and who has worked long enough to qualify for Medicare, you may be eligible based on your spouse's work history. But for more information and to look at eligibility criteria and potentially sign up for Medicare, you can visit Medicare.gov or call 1-800-Medicare.
Starting in 2025, Medicare will offer two new benefits that will be of special interest to people living with MS. First, Medicare participants won't have to pay more than $2,000 per year out of pocket for their Part D drugs. And second is the Medicare prescription payment plan. Sarah, who's eligible for this $2,000 cap on out-of-pocket drug costs, and how do they receive that benefit?
Great. Yeah, great question. In 2025, everyone enrolled in Medicare prescription drug coverage. So, anyone who has a Part D plan, either through Original Medicare Part D or a Medicare Advantage Part D plan, will have their out of pocket costs capped at $2,000 for those medications that are covered specifically under Part D.
Can you explain what the Medicare prescription payment plan is and how it would benefit someone with MS?
Sure. So the Medicare prescription payment plan allows you to spread out your out of pocket costs for Medicare Part D drugs into monthly payments, making it easier to manage high drug costs and stick to your treatment plan.
Whitney tells us she's heard about these changes, but doesn't know which Medicare part she has. As it relates to her MS treatment, what's the difference between Medicare Part B and Medicare Part D?
Excellent question. So, Medicare Part D covers most medications that you can take at home, including oral pills and self injectable medications. So, many MS disease modifying therapies do fall within those categories of being an oral medication or a self injectable medication that people get at their pharmacy or get shipped to them directly to take at home. Part B, however, generally covers medications that a person would receive at a doctor's office, a hospital, or infusion center that's administered by a healthcare professional.
Caroline says she's currently receiving her disease modifying therapy by infusion, but she's planning to switch to an oral medication at her next visit with her neurologist. Now, would joining the prescription payment plan now be a good move for her, even though she's not currently taking the applicable medication?
Yeah, so an individual can elect to participate in the Medicare prescription payment plan at any time during the plan year. And anyone enrolled in a Part D plan who thinks they would benefit from the Medicare prescription payment plan can opt in and sign up for the program either during the open enrollment period or again at any point throughout the plan year.
Henry's wondering if there's an extra cost to join the prescription payment plan.
There isn't any extra cost to take part in the Medicare prescription payment plan. One can leave the program anytime, but if you do leave the program, you will need to pay any remaining balance that you may have for your prescription drugs throughout the plan year. If you do miss a payment and have not paid the amount owed within 2 months of the due date, your plan can remove you from the Medicare prescription payment plan and will send you a notice of disenrollment.
Cornelius is planning his family's budget for next year, and he's wondering if this prescription payment plan will help reduce his drug costs over time.
Unfortunately, no. This option can help you manage your monthly budget, but it doesn't reduce or lower your drug costs. So it's not a drug discount program, but rather is meant to help manage costs throughout the year and allow someone to budget on a month by month basis the costs of their medications throughout the year rather than paying one lump sum at the pharmacy when they're receiving their medication.
Keisha says she's on the fence. Her MS has been stable and she's managing it well by taking a low cost generic medication. She says she really doesn't know if this payment option is the right choice for her.
Yeah, so she might want to consider participating in the Medicare prescription payment plan if she has a hard time paying her out-of-pocket drug costs all at once. If she paid over $2,000 in out-of-pocket costs in the first 9 months of last year, if she's ever had a single prescription cost of at least $600. You are not eligible for programs that would significantly reduce your out-of-pocket costs. You would want to budget and spread your out-of-pocket costs throughout the year. Reasons it might not be a good fit include if your yearly drug costs are low or stay the same each month, if you plan to sign up later in the year, if you prefer to keep paying for drugs the same way that you do now, if you qualify for extra help from Medicare, such as a Medicare savings program, or if you get help paying for your drugs from other programs like a state pharmaceutical assistance program, a coupon program, or have other complementary health coverage.
Tobin's MS medications are expensive, and unfortunately, he doesn't qualify for any additional programs, so he's planning to participate in the prescription payment plan. What can he expect?
In 2025, his out of pocket costs for Medicare Part D drugs would be capped at $2,000. And when he fills a prescription for a Part D drug, he wouldn't pay anything at the pharmacy. Instead, his drug plan would send him a bill every month based on his prescriptions and what he owes. So his monthly bill may change if he gets new prescriptions or refills existing ones, since there will be fewer months left in the year to spread out the payments. But if you want to know what a drug will cost, you can check with your health plan either on their website or by calling the health plan phone number or by asking your local pharmacist or getting in touch with one of our National MS Society MS navigators.
Spencer wants to know where she can find additional information and support in making her decision here. So, are there any resources available to help her?
Yeah, definitely. So again, contacting one of our MS navigators. So if you go to the National MS Society website and type in navigator, you'll be directed to a navigator specific webpage with all of their contact information listed. In addition, you can visit Medicare.gov. That website allows you to learn more about how this new plan might be an option for you and how it could affect you or benefit you. There's also the SHIP website, which stands for State Health Insurance Assistance Program. They offer free health insurance counseling at shiphelp.org, which is SHIPHELP.org. So those are some great resources to get people started with researching this topic.
Ryan says he's a little confused about the timeline here. Is participating in the prescription payment plan only available during open enrollment, or can he join anytime?
Yeah, individuals enrolled in Medicare Part D plans can join this Medicare prescription payment plan anytime during the year. So it's available outside of just the open enrollment plan in order for someone to opt in and sign up.
And how does he go about signing up?
Yes, he can go to the health plan's website or call the health plan, and the phone number for that is on the back of their membership card. Also, they can look at the Medicare.gov website as well. There's information on how to sign up there as well.
Well, I want to thank you for sharing some helpful and very timely insights about how to best take advantage of some of the changes we're going to see in Medicare in 2025. Today's program survey has now been posted in the chat for your feedback. Please take a minute and complete it to help us create programs and topics with you in mind. Please be sure to visit the National MS Society's website for information and resources on MS, connection opportunities, and ways for you to get involved. You can also connect with an MS Navigator to receive personalized support by phone, email, or through the Society's website by chat. A recording of today's program will be posted on the MS Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. Finally, I'll invite you to join me each week on the Real Talk MS podcast, where we continue the conversation that we start here. You can find Real Talk MS on Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Thanks for joining us for Ask an MS Expert. We'll see you next week.